This is part 2 of Principles of Quantitative Research. I'm just going to pick it up from the section on experimental studies. And here we are looking at studies that have a control condition attached to them. So the most common controlled study would be the experimental group and a control group, or the other one is the waitlist control. So in an experimental and control group, the experimental group for us receives music therapy, and then a control condition could be having recreational therapy or art therapy or something or other else. But the idea of a waitlist control is increasingly used in music therapy, and it's good in that it's much easier to recruit people into your study, because the waitlist control means that you recruit a large group of people at the one time. Half of the group have music therapy straight away, and the other half have music therapy after that intervention is finished, which might be 8 weeks' time, 10 weeks' time, 12 weeks' time, whatever. But when you're explaining the study to people, it's much easier to say everyone gets music. You either get it now or you wait for a few weeks and then you'll have it. And that's easier than trying to recruit people into a study where you say to them, you might be in the music therapy group or you might be in the recreational group. People think, well, I don't want to be in the recreational group. Or you might say, you know, you might be in the music group or you might be in the group that has volunteer services. So you can imagine that if you're receiving that information, you're thinking, well, if I don't get in the music group, I'm actually not interested in this study anymore. So the waitlist control is a really good way around having a control condition, but everyone gets music, and it's so much easier to then recruit people for that study. So the second of the experimental studies listed there are the randomized controlled trials. These are the most highly regarded because it means that there's a control for bias. So not only do you recruit people at one particular time, you then randomize which group they're in. And that's a better control. For example, you know, if people wanted to be part of a music therapy study and they all had some, you know, music experience behind them, then that would be a biased sample. So when you randomize people, you're basically testing whether your intervention is going to be useful for all people, not just people interested in music, for example. All right, we move on to the two group comparison designs, and I've already talked about the waitlist control and how that's useful for recruitment purposes as everyone gets the intervention. The other aspect about two group comparison designs is that you need to match people quite carefully. Now, a good example of a two-group comparison design is a study that was done in two different nursing homes. So one nursing home received music therapy and the other nursing home didn't have music therapy, but they had to match that the people in the two nursing homes had similar kinds of conditions like dementia, and that there were similar levels of dementia, similar levels of severity of dementia. So you match the symptoms. Another example would be if you ran two groups of music therapy for, say, children with autism, you'd have to match that the severity of the autism in both groups was pretty much the same, so that you controlled for that particular criteria. Now, the other aspect of doing quantitative research is the inclusion and exclusion criteria. You have to be careful, following on from the matched samples, I guess. I mean, if you were looking at the effect of music therapy on people with early stage dementia, then clearly you're going to exclude people in late stage dementia. If you were looking at often, I have to say, one of the reasons that people are excluded from the study is if they can't read English, if they can't read the measures in order to be able to answer the questions. So you might exclude people who are from different cultures and whose English is not sufficiently well established to answer the questions on the questionnaires. Sometimes you'll see studies where people with a hearing impairment are excluded from a music therapy study, and sadly that is an important variable. If people are really hard of hearing, then it would be very difficult to then say that any response was due to music therapy if they haven't even heard the intervention. So you'll see those sorts of exclusion criteria. Then inclusion criteria would be obviously targeting the thing that you want to study, but you might also include people between the ages of 20 to 35. You give a rationale for why you wanted to do that, of course, but so you need inclusion and exclusion criteria to make it really crystal clear to anyone reading about your study who was included and who was not. Counterbalancing is another aspect of experimental studies, and this is where you might use two different interventions. A standard one in music therapy would be to look at live music therapy versus recorded music. And so if you've got two groups, then you have to counterbalance that, which means that one group will have live music followed by recorded, and then the second group will have recorded first and then live. And then that controls for the sequence of the interventions. I just have included on the notes there a study that was done by Mercedes Pavlicevic about improvisation in music therapy, just as an example, coming back to this idea that in music therapy some people think that if you're doing a controlled study, then somehow you've changed the music therapy intervention. So this is a nice study. It might also be in your reading pack for applications B. But this is a study just to show that you can do a controlled study and where the intervention was improvisation and nothing was different than what music therapists normally do in improvisation. So they looked at whether individual improvisational music therapy sessions played a significant role in improving the rehabilitation of people with chronic schizophrenia. And so they had two groups. They had 20 in a control condition and 21 in a treatment group. And it was a matched sample. There's a good example of that. So people with pretty much the same level of severity of schizophrenia. And so both groups had an assessment at week 1, and they had improvisation in week 1. And then the group in the experimental group then had 10 weekly sessions of improvisation, whereas those in the control group didn't have anything through that period of time, but they got something at the very end of the 10 weeks. And at the end of the 10 weeks, they also had a chance to do improvisation again. So the treatment group showed a statistically significant improvement in clinical state measured by the BPRS, which is the brief psychiatric something or other rating scale. And that just looks at symptoms of schizophrenia compared to the control group. And the treatment group also showed a significant increase in the length of interaction, which is what you'd expect if they'd had 10 improvisation sessions. The control subjects, however, showed a small non-significant improvement in their music interaction scores, that's the MIR score, and the difference in the length of their improvisations between the first and the final session was negligible, which is what you would expect. So the discussion of that study showed that individual music therapy sessions are effective for people with severe schizophrenia in reducing some negative symptoms, and that it was particularly effective for those with higher levels of negative symptoms. So that's a good example of how they did a really good research study, but the music therapy intervention was just like you would normally do in clinical practice. Okay, now there's a little group exercise. There are 3 examples there. The first is to design a study about the effect of music therapy on the mood of people in aged care. So pose your question, determine your inclusion and exclusion criteria, design the study, and describe what measures you would use. And the next one, similarly, the effect of a single music therapy session on anxiety of young children due to have surgery, in a paediatric hospital. And the third option is to design a study about the effect of music therapy on quality of life of people who have a mental illness attending a day program. So if you'd like to work with one of those options and send it through to me on email.
Great. Cheers.